Greetings, David J. Coon with Qigong Awareness, hanging out with Keith. We are practicing Qigong here in the park. We're going to address right now a condition that a lot of people have out there, which is called high blood pressure, okay? High blood pressure, and can Qigong help high blood pressure? Absolutely. Simultaneously, there are specific practices that would help you more specifically accomplish what you're trying to accomplish. So let's understand high blood pressure. Go ahead and hold your hands down below the navel center, right between the navel center and the pubic bone, okay? That's where you're holding your breath. If you have high blood pressure, that's where you're holding your breath. If you have any other health condition, that's where you're holding your breath. This is an area we've all become very disconnected to. If we want to bring back healing into the body, we need to become connected to this area. Now, the energy associated with this lowest part of the lower dantian and down into what is called the root chakra, which in Indian practices as well as the Chinese practices, the color frequency of the root chakra is red. Well, check this out. Red goes to the head. Bring your hands up like this. Ever seen anybody really stressed out at your office, Keith? They go outside and they're just like this. Maybe you, like, oh, they're trying to calm themselves down, right? All that pressure is going up toward the head, all right? If the pressure is up in your head, okay, and you're a more advanced practitioner, you can go outside, bring your hands here, and over 15 minutes, bring the blood pressure back down, okay? But most people won't be able to do it if they're beginners because they have no discipline in a stationary standing practice. But this could also be done every day in bed. Bring your hands down here. Keep bringing your hands, your energy, and your breath down here, okay? So that's something to understand. Another thing we want to do. We have this practice called the waterfall. It's excellent for lowering blood pressure. You did this recently at your physician's office, correct? And one of our other students did as well. She dropped her blood pressure by 40 points. The physician actually wanted her to teach her how to do whatever exercise she did to drop her blood pressure 40 points. I'm going to show you what it is right here. It would help you if you understood that the red energy is here and we want to bring it back down here. So bring your hands up like this. This is called the waterfall. You may have seen this one before. But now we want to, when we bring our hands down here, we want to imagine we're picking up that red energy like magnets. Our hands are like magnets. The energy is coming to our hands. And now we want to walk the red energy so we don't go too fast, especially if your blood pressure is high. Go very slow Qigong, very slow, very slow. Don't worry about your breath right now. Don't worry about your breath. Leave whatever your breath wants to do, let it do, but move it about this speed. Only this speed. Only this speed. Imagine putting the red back where it needs to go. And if you can't visualize that, don't worry about it. It's not 100% necessity. For some of you, it will help. Others, it's just going to interfere. So don't worry about it. If it helps, use it. If it doesn't, don't worry about it. But bring this slow down, slow. This time we're going to do light inhale through the nose. Very easy, very easy, very easy. Very easy. Hold your breath a little and then exhale and sink your weight a little. Oh, let your breath come out through the mouth. Let the tongue drop to the bottom of your mouth. Inhale, easy. Exhale. If you start feeling any pressure, any stress from the breathing, just completely leave the breathing behind. Just move about this speed. Completely don't worry about the breathing. And just work with your movements, sinking your weight here. Exhale your breath right there. Typically when you're stressed out, it is way easier to just focus on your exhale. So exhale right here. Ah, make that sound like an ah sound, like the doctor says. Open your mouth and drop your tongue and say ah. And say ah. If your inhale starts working, great. If not, don't worry about it. Say, ah. Ah. If it bothers your shoulders or whatever to go up that high, just practice from here, guys. Ah. Ah. One more. How many times, David? How many times? Well, it varies. 5 times may work. How many times did you have to do it at the doctor's?
5 minutes.
About 5 minutes of practice. How many times did you do it, you think? How many repetitions?
Probably 20 to 25.
20 to 25 repetitions to get his heart rate and his blood pressure down. Unless you're pretty advanced and you leave the stressful environment, very few people are going to be able to do it in like 5 times. This is more realistic. 20 times, 25 times, 30 times. But if you're feeling lightheaded or you're feeling strange, you can only handle 5 times. That's fine. Do 5 now, do 5 later. Work with this one though. Let me know how it works out for you. I've seen many people change their blood pressure with this one. Thanks for tuning in. David J. Coon with Qigong Awareness. Check out our 21-day Qigong challenge. It's very easy, 10 minutes a day. You can find it on the website, QigongAwareness.com.